Hey there, and welcome back to New Nurse Academy, where I'm your girl, your personal educator, Tiffany Gibson, here to give you some tips on how to successfully pass nursing school and pass the NCLEX. Don't forget, please like, share, and subscribe to this channel, especially if things that I'm telling you are being useful to you and it's helping you along your journey. So today I want to talk about the 5 people that you're going to interact with when you are taking the NCLEX test. 5 people, okay? You got to remember this. They are another nurse, the physician, the patient's caregiver / family member, and an unlicensed personnel. When you're talking to another nurse in an NCLEX situation, it's usually a delegation issue, a priority issue, or a leadership management issue. It's probably a nurse from another unit that is being reassigned to your area, and the question is going to ask you what assignment is appropriate, which patient should the nurse see first, what is the patient's issue here, what is the nurse's first priority. So you have to think about that. Priority with delegation, priority with nursing instruction, and also safety and integrity of the patient. Next is going to be the physician. Anytime the physician is a part of a nursing equation is usually because something is urgent and emergent. And when you're answering these questions, you need to figure out first and foremost, 1, is there anything else I can do before I call the physician? So if you have an assessment in your answer choice, you are going to select the assessment first before calling the physician. The physician should never be the first answer unless there's no other assessment that the nurse can do in that situation. You also have to realize that there's some situations where calling the doctor is absolutely the only thing you can do. And so you're going to need to understand what those emergency situations are. Next is the actual patient, right? So when you are interacting with the patient in a question, it's usually an evaluation or an education question. So you gave the patient a pain med, you want to figure out if the pain med was effective or not. Or you're discharging and or giving the patient's instructions. And so the question would appear, you know that the patient needs more education when they say, so you're looking for the wrong answer, right? Or the question could be something specifically to the disease process and the patient is presenting with certain signs and symptoms, and you as the nurse need to figure out what is the treatment plan and what do you do next, okay? And then 4th, we have the patient's caregiver and or family member. More than likely, this is going to be an education issue. You are teaching the family member how to give insulin. You are teaching the family member how to help the patient who's walking with crutches or a cane. So which side should you be standing on? So a lot of the times when the patient's family member or loved one is a part of the situation, it is an education, communication question. So knowing how to communicate therapeutically and making sure that you're giving proper instructions. And then lastly, the unlicensed personnel. This can be a CNA, a tech, a student, a security, secretary, any unlicensed personnel that is a part of the patient care team. More than likely, you as the nurse, whether you are the RN or the LPN in the situation, is going to be about safety and delegation. So don't forget, when you're talking about the 5 different people you meet in a nursing NCLEX question, whether it is an RN or LPN exam, you will be talking to another nurse, the physician, the actual patient, the patient's family member, and an unlicensed personnel. If this was useful to you, let me know in the comments. I'm definitely here to help you along your NCLEX journey. Check me out over at www.newnurse-academy.com for more information and more ways to work with me one-on-one. Take care on your nursing NCLEX journey. Bye.